sponsors for this evening's event, the Yale Program for Recovering Community Health. Direct is one of the sponsors. The other sponsor is the Dignity and Advocacy Network, DAN. And if you didn't see the table out in front before when you came in, please check it out on your way out. Welcome to the international premiere of Healing Voices. This movie is being shown in approximately 120 different places around the world tonight, or today, depending on where you are. And we are very pleased to be one of those sites, and we are especially pleased to have the director of the film, P.J. Moynihan, joining us this evening. He was going to be here to introduce the movie, but unfortunately is stuck in traffic, so he will be here after the movie to answer your questions and to join into what is going to be a panel discussion in response to the movie, and then some audience participation as well if you can stay. So the movie will run for about an hour and a half. We'll then have about a half hour, maybe 40 minutes for the panel discussion and participation from you, the audience. To save time from after the movie, I'd like to go ahead and introduce our panelists now. First panelist, Dr. Ken Black. Just raise your hand. Ken joined the board of directors of Advocacy Unlimited in 2015. As a psychiatrist, he brings to this role his unique perspective, having been trained at a time when psychiatry was steeped in the humanistic, philosophic, and social relational tradition. Ken believes that over the course of the last 3 decades, psychiatry has shifted its focus to a reductionist biomedical disease orientation, diminishing the relevance of a person's experiences, beliefs, and meanings. Since 1979, Ken has had an office-based psychotherapy practice. After 16 years on the full-time staff at the Institute of Living in Hartford, Ken joined the Capital Region Mental Health Center as a part-time psychiatrist. For the last 12 years, he has worked with young adult services. Ken has developed a reputation as a disruptive innovator. Well before the recent research on potentially harmful effects of long-term use of neuroleptics became popular, Ken believed medications, especially for his young adults, were overemphasized. As a result, this tended to depreciate their personal stories of childhood trauma and emotional neglect. Ken's main interest and passion in his work centers around developing a peer-run integrated dialogical network of services for young adults in the throes of an initial experience of an extreme state. Ken hopes to work closely with Darren Drum, who's the executive director of AU, and AU staff to make this vision a reality. Ken's other passions are his 4 children and 4 grandchildren, spinning, yoga, and cross-country skiing. Thank you for being here. Next is Claire Bien. Claire has a master's degree in counseling psychology and works as a writer, grant writer, and public and community relations professional at The Connection, a nonprofit human service agency in Connecticut. Claire has struggled with existential and emotional issues since her late teens and has a family history of suicide. She is also a voice hearer who, thanks to a habit of self-guided and professional therapy, learned to challenge her demons and negotiate the conditions that ultimately allowed her to regain control over her mind and life without the need for ongoing medication management. In 2014, Claire was trained as a Hearing Voices Network USA support group facilitator and started the Hearing Voices support group at Yale New Haven Hospital, Psychiatric Hospital. She's also a founding member of the board of directors of NAMI Elm City and continues her NAMI involvement as a member of NAMI's Public Policy Committee and as an In Our Own Voice presenter, telling her story of illness and recovery to people with lived experience, family members, providers, students, legislators, public policy officials, and everyone else who will listen. Her memoir, Hearing Voices, Living Fully, Living with the Voices in My Head, with a foreword by Dr. Larry Davidson, that's me, will be published by Jessica Kingsley Publishers in June 2016, and there's a very nice flyer for the book also out on one of the tables in the foyer. Our final panelist is Judy Murray, who's a registered nurse. Her journey has taken a turn when she lost her son Dan to suicide in 2014. This guided her to found an organization for mental health reform, DAN, Dignity and Advocacy Network. Their mission is promoting mental health and preventing mental health conditions through research, advocacy, education, and service. Judy is a public speaker for DAN, presenting her and Dan's personal story as they struggle through the traditional medical model of our mental health system, and how those flaws, along with her son's pain, led to his suicide. She sits on the board of Connecticut Suicide Prevention, is a member of the Elton Haven Behavioral Health Patient and Family Advocacy Council, a facilitator for the Hearing Voices Network at Yale and in the community. She's also a member of ISPS, the International Society for Psychological and Social Approaches to Psychosis. Judy envisions a time when the diversity of human experiences will be accepted by all, and then healing will be possible for everyone as they travel through their purposeful journey. The showing of this movie is very timely in that Connecticut now has a number of Hearing Voices groups running by people like Claire. If you're interested in learning more about that, I believe there's literature out in the foyer as well. And without further ado, let's watch the movie. To the director of the film, P.J. Moynihan. I just mentioned before I turn it over to P.J. that he won the Indie Spirit Award at the Boston International Film Festival.
Thanks for coming, folks. Nice turnout here. We shot down for another screening in Cambridge earlier today. And as you know, this is part of a kind of an organized release of the film that's happening. Yesterday, today, over the next couple of days, there's over 130 screenings that are happening, anywhere from Perth, Scotland, to New Zealand, to San Francisco, to Washington, D.C. So the idea is that we show the film, like we just did, and then we open the floor up for a discussion, like we're about to do. Our intention in producing the film from the onset was we wanted it to be a conversation starter. And so this is really a tool for people that are doing this work, that care about these issues, that really want to see some change happen across the board to maybe communicate to a general public or to figure out a wormhole of sorts to have a very difficult conversation in part, but a very important conversation about a really complicated social issue. So we're really grateful that you guys turned out tonight. Very grateful to Larry and Judy for organizing this. We hope this is the first of literally thousands and thousands of these events, kind of all geared towards kind of rethinking in certain ways, how we approach this issue of mental health. So thanks for coming and looking forward to the discussion.
Since I introduced all of you before, perhaps you could just start with giving us a brief sense of your impression or reflection on the movie.
Hi. Can you hear me?
Yes.
All right. Thank you for being here. I need to stop. I want to say thank you for being a part of this global movement for changes in our mental health system. And I want to share my personal thoughts on the film and also what could often happen when using the medical model for psychiatry versus this different approach. Healing Voices to me is a reflection of our growth in humanity. It has the potential for us to turn our thoughts inward and return to the roots of who we really are, which is we are all open and we're all connected. And somehow we seem to lose value of that along the way. This can be a stepping stone to awaken our soul and remember that we are all connected, and with our respective personalities, which explains the diversity of human experience and behavior. Our different reactions to stresses and incidents in the external world manifest in behaviors. And behaviors are perceived sometimes as being unusual behaviors. And when they are, the reason they're unusual is because we have this very, very narrow understanding of what normal is. And when we have unusual behaviors, this translates into an illness and then it becomes pathologized. I want to talk a little about my organization. I have an organization for mental health reform called DAN, Dignity and Advocacy Network, and I created this in the wake of my son Dan's suicide. He was a voice hearer. 2 hours after he was home from the hospital, he said to me, "Mom, I know what I have to do now. I'm very clear. I have a plan. I'm going to make a statement about world crisis, about the disconnection of humanity, the inequality, the lack of love." And he said, "The world's supposed to spin on love, not power and money." And I'll spare you the details of his plan, but Dan had just come from the one place that should have been able to help him. I put my faith and my trust in them and shortly realized that they didn't know how to help him, and neither did I at the time. I had the painful realization at that moment that it was solely up to me as his mother to keep him alive, and in my heart I knew that my love was not enough to save my son. Only 2 weeks after discharge from the psychiatric unit, he followed through with his plan, although he altered it a bit, trying to make a statement in the only way he knew how, because nobody was listening. I promised him that night that I would be his voice, and that him and many others would finally be heard. There's a woman by the name of Eleanor Longden. She's a British psychologist and a voice hearer. And I like how she puts it. She says that we see that they're in pain, but we don't hear the story they're trying to tell us, because we only see illness and disease. And when we are certain that the source of someone's experience is an illness, it becomes invalid to us, and then we try to suppress it with medication, rather than allowing them to work through the experience and allowing for meaning, purpose, and growth. I commend Jen and Dan, 3 individuals who escaped the trenches of the traditional mental health system and who have the courage to stand before the world to show us that there is a different, better way. And PJ, director, producer, and writer, thank you for your never-ending dedication and brilliant approach to shedding light throughout the world to change the conversation around mental illness. Thank you.
I'd like to thank Judy for inviting me to be part of this panel, and Larry and Judy for sponsoring this film. As a voice here, I am, so pleased that this film has been made and really prompting the conversation worldwide. As a voice here, I do resonate with Oryx, Stan's, and Jen's stories. For obvious reasons, I feel most akin to Jen. We are both mothers. I was hospitalized. I've been hospitalized only for about a total of 2.5 months in 83, 84. And after I was discharged from the hospital in 1984, over a period of almost a year, I weaned myself from medication. I did have to go back on medication as an outpatient in 89 to 90, but otherwise I have been medication-free. Sarah Dalvodal, who is, I believe, director of the Western Mass Recovery Learning Center, has made a video, which I watched a few years ago before I really knew much about the Hearing Voices Network, to the effect that non-compliance saved her life. I would have to say that partial compliance saved my life, because Haldol, which I was given in the hospital, stopped the voices immediately. And that was enough to get my attention. And when I was discharged from the hospital, I was put on 10 milligrams of Haldol, and my eyes started rolling in the back of my head. And because the staff was terrified, they ended up putting me in restraints, which were not removed until I was given shot of Benadryl, had to slept it off, and then they were removed. But I felt so wooden and lethargic in a memoir, which I am shamelessly promoting. I write that on Haldol, I felt like a piece of heavy rubber with a heart and soul of wood that was going through the motions of being human. And that is what medication is like. And medication, I believe, absolutely causes so many of the negative symptoms of what is called schizophrenia. It is, it robs us of our dignity, our ability. When I was a few months after being discharged from Yale New Haven, I found a job as a research assistant for a sociology professor at Yale. And there were days when, it was May, and it was beautiful, and the trees were blooming, the birds were singing, and I would find things in the library that I knew my professor would be really pleased with, and I would say, oh, I'm so glad. I know Professor so-and-so will be really, really happy. I'm just really happy. And so over time, I weaned myself from the medication, but I always, because I'm a scientist's daughter, I believe in science, I believe in medication, I trust doctors. And so I would find the balance between the medication and what is real. And if things started going awry, if I started getting paranoid, if I started feeling, if the voices showed signs of coming back, I would go back on the medication, just a little, just enough to keep the edge on. And I would engage in therapy, both my own self-administered and professionally administered. And over time, and checking things out with people. Dr. Sylvie Jacobs, who is the former director of Connecticut Mental Health Center, and I'll stop in a second, but said that psychotherapy is a biological intervention, and it absolutely is. Changing the way we act changes our brains, and it is more powerful than medication because we are able to be fully ourselves.
I want to thank Judy for inviting me. I almost wasn't going to accept the invitation because I had seen the film at the Mark Twain house, and we were there. So this is the second time seeing the film. But first I have to thank Larry and everybody for being here. But what happened to me tonight was interesting for me because I didn't catch, in the first time I saw the film, Oryx's experience when he went off to college. I don't identify as a peer, but when I went off to college, I went into a pretty significant depression. And I didn't catch it. And today I did, and I could feel some of it returning. I realized why I didn't catch it the first time. The film is terrific as getting a message out that's extremely important. We dehumanize human suffering, and we have to humanize human suffering. And the power of the film, I hope, will reduce people's fears of other. By definition, it's primordial. We all come from tribes. And breaking down the walls between tribes has been an evolutionary phenomenon. So language is very important. We have to stop using the language of mental illness. We have to stop using the language of DSM, symptoms, diagnoses. There's a place for both. And my mission, the little piece that I can contribute, is to hear all these voices that continue to develop the alternatives. There's always going to be a need for a system. The system has its bureaucracies and it has its limitations, but it also has some of its values, at least for acute states when a person is so agitated. Hopefully we can introduce some of these alternatives and views inside the system. Slowly, I think that's possible for change, but I'm too old, and I've been at this for 40 years, so my efforts are for others to try to influence the system while we also offer in Connecticut an alternative. We have 17 hearing voices groups now. We have a few alternative to suicide groups. Hopefully we'll fight to get the peer respite in Connecticut back into the budget that was taken out because of the cuts. We're going to train people in intentional peer support. And last thing I'll say, because we want to leave time for discussion, Courtney Harding, right here at Yale, brought up the notion of an army of peers, an army of mentors, actually used that word. People recover from severe illnesses and they go on with their lives and we don't know of them. They're working, they're enjoying life, they put it behind them. She said, what if we call them back? What if we call them back and ask them to assist us? Because those who are going to be peers in the system, who are going to be staff and paid and so on, it's not going to be enough. So we're going to need others. And that's where intentional peer support comes in, and inviting, getting out this message, and inviting people who have had experiences and can relate. Because it's all about being with and not doing to. It's all about what happened to you and not what's wrong with you. These are not difficult messages to teach. Most people understand this. Most people get it. Most people can be empathic. It's they're frightened. And our culture has frightened us because of the distinction between those people, the mentally ill. So thank you for having me.
Comments or questions from the audience? David.
I heard something about a paradigm shift from electroshocks, lobotomies, and other more physical interventions to a medication-based paradigm, which succeeded the time, say, after the 50s and 60s, new psychiatric meds started coming around. Treatment started to be based on psychiatric medication. And then I think I heard them say that paradigm or that system of that orientation of treatment also has its limitations. Was that the message, part of the message? And that other?
So, part of what we felt was important in the film was to place this all also into a historical context. So, and obviously Robert Whitaker was like the resident historian in the film, so he looks at treatment, quote unquote, over time. And just to give you a sense of where that's led to now, and yes, by and large, since the 50s, the psychopharmacological interventions have been the primary form of mental health treatment, and so, yeah, I guess that's part of not necessarily the message. It's almost more like part of the backstory, and to me, I think a lot of what you need to almost understand all of that in order to look at this all in a cultural context. So, what is a culture of psychiatry? What is a culture of healthcare? And so the implication, if we just accept this medical model as the only way of looking at things, is that there's something wrong with the individual and that society is fine, right? And so to me, what's important about, one of the things that's important about the film is that, I think we should do less, the message of let's do less blaming or labeling of the individual, and more maybe self-reflection upon who we are as a culture. I mean, from the food we eat to the air we breathe to the schools that our children learn in. And it just seems tragic to think that in so many cases, whether it's a school system or whether it's someone who might be having mental health issues because of their diet, for instance, that we don't really look at this stuff in the broader context of our culture. And maybe in a lot of ways it's people responding to the culture in negative ways. And so if someone's not fitting in, then there's something wrong with them. The implication is that we live in a healthy society. So, long-winded answer to your question.
Thank you so much. This is a great event. Thanks for the people putting it together. And one thing I want to note that there's a camp up in Maine. It's called Camp Kita, and this is for any child that has experienced suicide. The camp is free. It goes from August 16th to August 23rd. Any youth, 9 to 17-year-olds is invited. And so it's Camp KITA, K-I-T-A. You can look it up on the internet. And KITA stands for Listen. They have counselors there and much help. Growing up, I heard about 2 suicides. And my immediate thought was dysfunctional family. 3 years ago, my son Kyle took his life. Now I know it's not dysfunctional family. It's mental illness. And he was my favorite son. And anybody that says you don't have a favorite son or a favorite daughter, I don't believe them. Not true. And, we just have to keep working on it. And mental health. 75 years ago, if you had cancer, they put you in the back bedroom. People stayed away from you. They didn't talk about you. 30, 40 years ago, if you were gay or lesbian or transgender, you didn't speak about it too much. You kept it quiet. Things have changed for both of them. And now mental health, this is our time. We're going to make a change. At lunchtime, I had a meeting with Reverend Bob Flanagan. First of all, we're going to start we are going down to the Capitol in June, the middle of June. Myself and about 300 people from across the country with the American Foundation for Suicide Prevention. We're going to see all our senators, all our reps, try to get some bills passed. And on the meeting today I had with Reverend Flanagan, we're going to start a state advocacy. We're going to meet, we're going to get a group together, and anybody that wants to sign up, just go to afsp.org. That's the American Foundation for Suicide Prevention's webpage. You don't have to join us at the Capitol, but you can at least put your thoughts in. You can write emails, you can write letters. We've got to make a change in this. And once again, thank you so much, everybody. Thank you. Yeah.
Hi, I think it's rather ironic that at the time when all these new alternative non-medical things are becoming more and more available in our state, they're also slashing the budget. If they've slashed the budget for the Peer Respite Center, let's start our own. I actually see optimistically good things coming out of bad things. So I see good things coming out of this cut. More peer mentors. Not that I think the cuts are good, okay? But let's rise to the challenge. And I'd like to hear what you guys think about this idea.
If I start this one off. So, I think it's a lot to ask for entire systems to change. It's not that they can't change, it's not that those changes can't ultimately happen over time, but as it relates to social change, I don't think it's going to be the system that changes first. And so, a wise friend, I had a conversation about this project with a wise friend, and he said, kind of what's the end game? Are you trying to get enforce policy to get through, or is the film a tool for system change, or do we just have a marketing problem? And I thought it's a question I thought long and hard about, and I think part of why we've gone so far down this road of this medical model, this one-size-fits-all approach, is it's been driven largely by a for-profit healthcare system, and it's been driven largely by pharmaceutical marketing. So, this film does have a position. We're not also showing the person whose psychiatric drugs work for them, because you just need to turn your television or open a magazine to see that sort of propaganda being pushed on you. And so this film is in essence trying to solve the marketing problem. I believe it's like a supply and demand thing. So it's like if enough people know that there are alternatives and know that there are certain specific things they can do about it and know that there are resources they can use to make those things happen, well, that's to me the driver of social change, as opposed to sitting around and waiting for systems to change. The healthcare industry is, I don't need to bore you with the politics of that, but it's like waiting for the government to get something done. in a lot of ways, it does take the government to make the system like the healthcare system to change. So I guess my point is I don't believe that this film is a tool for system change. I think systems will change over time if the people demand it. But I believe that your call to action there is like, that's the sort of thing I want the film to move people to. You know, like it mentions in the movie that Oryx Cohen and Will Hall founded the Freedom Center. That's just one example of a group of psychiatric survivors. And I heard that term psychiatric survivor and I was like, what does that even mean, you know? And I've learned over time what that means. But they had no budget, they had no organizing body, they weren't a 501c3. I mean, they essentially decided, let's start meeting in church basements. And in a lot of ways, that's how the peer movement started here in the US. And that type of initiative and incentive is going to, I believe, be the catalyst for change, as opposed to policy. So.
I absolutely embrace peer respite and the use of peers in recovery. But what I would like to see, rather than two separate systems growing up alongside one another, would rather an integrated system. Much like the work that's being done at the Yale program at PERCH, the Yale Program for Recovery and Community Health. I think that peers need to have the supports of professionals that I have since, and correct me, I know about this much of the literature, but there is some literature to the effect that peers are really, really effective in the early stages of recovery and reaching out to people. But as people get better and begin moving toward, true independence and reintegration into the community, there tends to be a little bit more tension, and a lot of times people who are, moving toward recovery are more, affiliate themselves more with the professionals. And my take as a voice here, as a person in recovery, is that we peers in our very peerness can be sort of pushy, and if we don't know a lot of the professional, that stuff, then we can be a little bit hard-nosed about things, and our solutions are not right for everyone. And it takes sort of standing back and a cooler and wiser head, I think, a lot of times, to move people truly toward the paths that they need to take. The person-centered approach isn't always easy for someone who still has his or her own struggles. And I also, one more thing, I had a conversation with the head of a psychiatric hospital who, said that peers take it really hard. Well, actually, Yale New Haven was looking to use peers in the emergency room, and when people are not able to keep someone out of crisis, we take it really, really hard, and so we peers need some protection, I believe.
Yeah, I'd like to speak to this. I agree with you. System change for a large bureaucracy will take time. Last Friday was the first, what I hope to be, annual conference that Advocacy Unlimited is going to sponsor to announce to Connecticut the Karuna Network, K-A-R-U-N-A. And it's time that we're able to put a lot of the alternatives together in what we feel is a network. Our hope is to establish the first peer-run open dialogue team in Connecticut, or maybe even in the country. I discussed with Mary Olson after a webinar, what do you feel about training peers to be not only members of teams, which they are in the UK and in Europe, but what about as open dialogue persons themselves? And if I'm not mistaken, I'll have to check with her because I'm still wondering if it was just too much of my wishful thinking. I think she said that's the future. So we're hoping that we could move this future along more quickly. And we're hoping to have an annual conference to keep introducing these ideas and so on. And a small pitch. My little bit contribution to this is a course that started 2 Tuesdays ago through the West Hartford Continuing Ed, and that's just reaching out to community members to discuss these alternatives and to introduce all the concepts in the film. And maybe you could send me a trailer or something? No, really, I could use it because I also use a lot of videos. Eleanor Longden and Deborah Lampshire, a number of Robert Whittaker's takes to try to reduce fear that these are persons who went through some difficult times and states, to see it as a spectrum of human behavior. Given the circumstances, you can be me, I can be you. That's really the determining factor, that and some of how we're made up. So that's a 6 weeks, it's going to run 3 times a year. There's a little flyer outside, so I welcome your participation.
Let's take one last question or comment.
Hi. I'm wondering if anyone has done empirical, qualitative or quantitative research on the content of voices. And I noticed the film is called Healing Voices, but there's nothing in it about the actual voices. And might it be useful if you could find out if everybody is hearing the same types of voices, or are there different categories, or something like that?
Thank you.
So certainly, if you go to Intervoice online, Intervoice is the organizing body of the Hearing Voices Network. And there's also HVN USA, the Hearing Voices Network USA. Through those 2 websites, there are resources that are available to essentially reflect like the evidence base for the efficacy of the Hearing Voices Network. But what I would say is, apart from empirical data, so we might not address that in the film, but I think that the core message that we're trying to communicate as it relates to voice hearing is that the voices have meaning. So whatever those voices are for an individual, they're going to always be in relationship to that person and their life and their experience and their trauma, their relationship to society. So just like there's no one-size-fits-all approach to treating someone in psychotic distress, there's also, maybe no one-size-fits-all approach to putting an empirical analysis to voice hearing, because I think in a lot of ways it's always going to be specific to the individual. But I also do agree with you that a lot of these, quote-unquote alternatives to the medical model really they need to be more well-funded, so that there can be resources put into developing an evidence base. But the Hearing Voices Network, I think, comparable to other alternatives, there is some level of empirical data that's been gathered over time. So I would encourage you to look for those resources online, even though we don't address them specifically in the film.
I just add to that, Marius Rahm and Dick Costens, I think? Dirk Costens. Living with Voices, 50 Stories of Recovery. They talk about the Maastricht interview, which is a pretty detailed interview, working with people to hear from them about their voice hearing experiences. And they do tell 50 stories, and that's the second part of the book. The first part of the book is collating, is getting themes and talking about the nature of voice hearing experiences. Although unique, there are some common things. It's a tremendous resource and very poignant, inspirational stories too.
And I'd like to add to that, one of the things we're taught in the Hearing Voices training is that the voices often are the voices that we heard in the past. And it really is very particular to each of our personal experience. I'm Chinese, I am native-born Chinese, but I grew up reading Western literature because my parents thought, when in Rome, do as the Romans do. And so my delusional content is entirely Western. There is nothing Eastern or Chinese about my my voices and the thoughts that I have. I think part of what helped me achieve my recovery is my culture, because they talked about a lot about behavior, and I, when I was in the throes of, in the thrall of my voices and didn't know what to say, I would just retreat into myself, so I'd be a little bit more quiet and self-effacing than I usually was.
And so I do want to mention on the table outside, one of the things that we did for all of our screening partners was we made a list of resources. So on the table there's a white sheet of paper on the Healing with the Healing Voices header that has a list of different resources for different demographics. So for healthcare professionals, you can go online and take Mad in America continuing education courses. Larry did a course with us. For the links that I suggested about InterVoice and HBN USA are listed on there. There's information about peer respites. So there's a number of different resources that you can take away. We really encourage you to do your diligence on some of these other alternatives that are out there, and they're also all available online through our website, which is healingvoicesmovie.com. And lastly, I would like to encourage any of you that are moved by the film. What we're trying to encourage people to do out of these screenings is go on social media, Facebook, Twitter, Instagram, whatever, and respond to the film, say, for better or worse. I saw this film tonight, here's how I feel. Here's a link to the website, here's how you can learn more. In a lot of ways, we're looking at these 130 events and all the people attending them as, like I said at the onset, the people that care about this stuff most. And this is why we wanted to start by delivering the film to this audience, because we want you to take it from here and not just have this be a night out. So really encourage you to try and take something from this beyond your experience of the event itself. So thank you.
Thank you very much.